Welcome to Chapter 3 of Food and Culture. This chapter presents a broad and limited overview of intercultural communication concepts. Our Chapter 2 lecture ended with this quote from Hippocrates, and it is also appropriate to begin Chapter 3 with it. Observe the nature of each country, diet, customs, the age of the patient, speech, manners, fashion, even his silence. One has to study all these signs and analyze what they portend. The authors of our text use an iceberg analogy to describe how a person's cultural heritage can impact communication. The tip of the iceberg that shows above the surface includes only the most obvious elements affecting communication. These include ethnicity, age, and gender. Beneath the surface, however, but equally influential, are several other characteristics that we can't see. These include the degree of acculturation and assimilation, socioeconomic status, occupation, health condition, religion, sexual preference, group membership, educational background, and political orientation. Communication is an action chain where one phrase or action leads to the next. For example, we say thank you and expect that the person we thank will reciprocate by saying you're welcome. Someone who asks us a question generally expects an answer. If we don't respond as expected, communication breaks down and the relationship can deteriorate. Most of us become uncomfortable very quickly when we initiate conversation with someone and they don't talk back. Most of these communication expectations are largely unwritten and can vary by culture. Interpersonal relationships are also largely based on personal communication preferences. We don't normally form deep relationships with those who don't have the same communication norms as we do. In addition, group interactions are often dependent on cultural or social norms. With that said, however, stereotyping can occur when we overestimate another's degree of association with a particular culture or social group, since people often do not behave in ways typified by the group as a whole. Verbal messages are best for conveying content, but can only be interpreted within each individual's cultural context. But our cultural context is so much a part of how and what we perceive that it is often hard for us to believe that other cultures really don't have some innate background awareness of what we mean to communicate. Issues common to differing cultural worldviews in the area of communication include the role of the individual in a group, perceptions of power, authority, status, and time, and the significance of affective and physical expression. This is often termed low or high context. The level of tolerance for uncertainty and ambiguity also differs and is termed uncertainty avoidance. These cultural communication worldviews often occur on an unconscious level. Varying by culture, context is in short then defined as the speaker's affective and physical cues that are used to indicate meaning like tone of voice, facial expression, posture, and gestures. In low context communication, the actual words of the message are more important than who is speaking or other nonverbal aspects. Information is generally delivered in a logical, linear sequence, and it is explicit, straightforward, and unambiguous. In these cultures, the focus is on the speaker. Low context speakers are often impatient with high context speakers, and they often miss these nonverbal cues. They are also very individualistic and value their privacy. Examples of low text communicators include the Swiss, Germans, and Scandinavians. In high context cultures, the meaning is more likely to be in the context, not in the words. These people may use vague or incomplete wording, with the underlying meaning actually being found in who is speaking and how. Small nonverbal signifiers are highly significant. For example, squirming or small sounds and eye movements indicate the speaker's actual attitudes and feelings. Since the emphasis in high context cultures is on nonverbal communication, one must in essence learn to read between the lines. Because of this, misunderstandings can easily occur. Generally, these cultures are more group-oriented and mutually dependent. Examples include those of Asian, Middle Eastern, and Native American descent. Here we can see the various cultures laid out in a continuum of high context to low context. As I mentioned earlier, you can see that those of Swiss and German descent are extremely low context, while those from Latin America and Asia are at the top as the most high context cultures. Given the differences in how these people communicate, a mismatch between a low context sender and a high context receiver can cause impatience and give offense. In low context cultures, the individuals relate to one another according to accomplishments and personality, rather than following specific roles that are dictated by their membership in a group. For low context cultures, self-realization is a goal, but in high context cultures, the group association is more important and oneness with the group is desired. Low context cultures value being on time and not wasting another's time. They tend to be more monochronistic, interested in finishing one thing before starting another. High context cultures, on the other hand, are often polychronistic, pursuing many tasks simultaneously. These are the patients who will answer their cell phones in the middle of appointments to give attention to a personal relationship. Low context providers, of course, find this to be rude. So, are Americans and biomedicine more high context or more low context? If you said low context, you are correct. Biomedicine is usually low context, with the message being considered as more important than the relationship. A mismatch between a low context sender and a high context receiver can cause impatience or cause the patient to become offended. It may also create an environment of uncertainty or ambiguity, as said before. Cultures have different tolerances for this uncertainty and ambiguity. In cultures with high uncertainty avoidance levels, consensus is desirable, and deviation from the norm creates anxiety. Low uncertainty avoidance cultures, such as ours here in the U.S., are more curious about the unknown and different. They are also more informal, willing to accept dissent, and open to change. Most cultures, however, have higher uncertainty avoidance preferences. Therefore, practitioners need to be aware that health advice that contradicts the group preferences may not be followed. In low-context cultures, power or status is attributed based on the role or job of a person. Power distance is small, and people are seen as equals who are more likely to question directions and ask for explanations. In high-context cultures, superiors are seen as automatically due respect and are expected to exercise authority without questions or explanations. Miscommunication arises when the people involved miscalculate one another's power distance. For example, coming from a high-context culture, the client wonders why the healthcare provider, the supposed authority, is asking for the patient's input into dietary choices. Instead, the provider is expected to provide all the answers with little participation from the patient. Many cultures are gender-oriented as well. Masculine cultures are aggressive, task-oriented, and materialistic. Sex roles are strongly differentiated, and men are generally given more authority. Cultures with a masculine orientation include Germany, Hong Kong, and the United States. In feminine cultures, on the other hand, quality of life is more important, and men and women share equally in the power structure. This includes countries such as Denmark, Sweden, the Netherlands, and Norway. Gender role affiliations can cause conflict between a healthcare team and a patient. For example, those who are from a country with a masculine orientation may refuse to take instructions from a woman. They will take instructions from a male nursing assistant sooner than they will take it from a female physician or nurse. Treatment in this case must include compromise and consensus. So, for a quick review, low-context cultures are monochronistic, preferring to complete one task at a time, with deadlines being most important, while high-context cultures are polychronistic, preferring to undertake many tasks simultaneously, but not at the exclusion of personal relationships. Courtesy and kindness are the most important in these societies. Nonverbal communication reinforces the content of a verbal message. If it contradicts the words that are being said, it can be confusing, and so it should be consistent with the verbal communication. For instance, although a nurse may verbalize to a patient that she is not irritated with them for ringing their call bell every 15 minutes, her body language may tell them differently. Those from high-context cultures will often pick up on this more readily, since high-context societies highly value nonverbal communication, more so than those from low-context cultures. Of course, customs involving touching, gestures, and eye contact vary across cultures, independent of whether the culture is high or low context. Here we have some examples of how our body language can tell others a great deal about us. Although the men in this photo are all dressed very professionally, their body language portrays some very different things about them. The man on the far right looks like he needs to go home and go to bed, while the man standing next to him comes off as being a very weak and ineffective individual. On the left side of the page, on the other hand, we have someone who looks like he could be simply enjoying having everyone else do his work for him. The man standing next to him, however, appears to be an effective and hardworking individual who is ready to take on the challenges given to him. There are many ways that we communicate nonverbally. Without taking the actual words into consideration, we can communicate a great deal through touch, glance, eye contact, volume, vocal nuance or subtle variations in tone, proximity, and gestures. We also communicate through our facial expression. Are we smiling or frowning? Intonation or variations in pitch, our dress, posture, even the way we smell. Our word choices and syntax or the way we put our words together also communicate something about who we are and how we feel. For example, using improper grammar often makes others think that we are uneducated right off the bat. The sounds we use, which are called paralanguage, also communicate a great deal. For example, when I do this, what does it communicate to you? Probably that I'm saying, "What a shame," or "Shame on you." Some of us may remember this sound all too well from our childhoods. I've posted the link to a fun internet quiz on paralanguage under the Chapter 3 module. So let's go into more detail about nonverbal communication through touching. Forms of touching include handshakes, hugging, kissing, a hand placed on the arm or shoulder, even just bumping into someone. Of course, these vary due to gender, age, physical condition, and relationship. You wouldn't kiss and hug your mother in the same manner that you would kiss and hug your significant other. A vigorous handshake may be seen as aggressive, while a limp handshake may portray weakness. Many potential employers actually use the handshake as a way to evaluate the effectiveness of the person they are interviewing. When I teach this class in the classroom, we always take the time to practice what an effective handshake should feel like. The head may also be considered sacred in some cultures. Even here in the U.S., it is generally not acceptable to touch the head of an adult, although it is common to do so with a child. Aversion to touch may also be offensive. If someone recoils when we try to touch them, it causes an immediate break in communication. Gestures, facial expression, and posture also communicate a great deal and can vary around the world. Crossed arms may indicate hostility. Thumbs up may be obscene. Beckoning with a finger may be lewd or threatening. A nod of the head may not mean yes or no. Vietnamese may smile when they are displeased, and so a smile is not even universal. The feet may be considered the lowest and dirtiest part of the body, with the soles of the feet being especially offensive. Please take the time to view the videos and website that I have posted about how gestures vary around the world. I think you will find them to be very enlightening, as well as entertaining. They are definitely good to review prior to planning a trip to another country, since Americans are often perceived as rude for making gestures that have different meanings in other countries. Eye contact rules can also be very complex and are generally unspoken. Is eye contact direct, prolonged, quickly averted, or even totally avoided? While most Americans consider direct eye contact to be indicative of honesty and openness, Filipinos actually consider it to be an expression of sexual interest or even aggression. Comfort levels with regard to personal space also vary. Some cultures may be totally comfortable being extremely close to others, even if they do not know them. Positioning choice may vary between sitting and standing. In this photo, the woman looks like she's not very comfortable being close to the other person sitting on the bench, even going so far as to face away from him. The study of proxemics is the life work of anthropologist Edward T. Hall. According to Dr. Hall, intimate space is the closest bubble of space surrounding a person. Entry into this space is acceptable only for the closest friends and intimates. This includes touching up to 18 inches. Personal space is for close friends and is about 18 inches to 4 feet. Social and consultative space is the space in which people feel comfortable conducting routine social interactions with acquaintances as well as strangers. This is generally between 4 to 12 feet. And last, he indicates that public space is the area of space beyond which people will perceive interactions as impersonal and relatively anonymous. This consists of more than 12 feet. Examples include a speaker at a conference or people in a supermarket or on the street. You probably won't be surprised to hear that there are gender differences with regard to communications as well, with there being distinct differences between the speech patterns in a woman and those in a man. A woman speaks between 22,000 and 25,000 words a day, whereas a man speaks between 7,000 and 10,000. Even in childhood, girls speak earlier than boys, and at the age of 3 have a vocabulary twice that of boys. Research shows that there are differences in how men's and women's brains are wired in terms of language and speech. This means that a man talks in a linear, logical, and compartmentalized way, which are features of left brain thinking, whereas a woman talks more freely, mixing logic and emotion. These are features of both sides of the brain. This also explains why most women talk much longer than men each day.